Hey everybody, today's the first day of September and the first day of Childhood Cancer Awareness Month. For many of you, you know that means that I'm going to be posting videos and Facebook posts regarding various aspects of childhood cancer. Many of you know that I was diagnosed with childhood leukemia in 1994 when I was 14 years old and in the 8th grade. My treatment consisted of 2.5 years of chemo and 10 days of cranial radiation. ALL, acute lymphocytic leukemia, the kind of cancer I had, is one of the most survivable cancers out there. But I have to ask at what cost? Many people think cancer treatment ends when the chemo ends, but that's really not the case when it comes to childhood cancer. Childhood survivors live with the aftermath of their treatment for the rest of their lives. My long-term effects that I have to deal with include osteopenia, which is the precursor to osteoporosis. I was diagnosed with that only 8 years after my diagnosis, and that was due to the high dose of steroids that I was given. I've had to deal with depression, with suicidal thoughts. Why? Because 15 years later, I finally dealt with everything cancer took from me. Friends, not just because they died of cancer, but because they didn't know how to help me cope with being a survivor. It took away, in some aspects, my entire teenage years, and to some degree, some of my 20s. Because I didn't know how to relate with my peers. I didn't know how to fit back into society. And most recently, I was diagnosed with 2 spots of basal cell carcinoma on my head. I've always known that I had a higher risk of skin cancer because of the chemo and the cranial radiation, but I really never thought it would happen to me until last year. I'm at a higher risk of other skin cancer spots, a brain tumor, and cardiac issues, all things that I actually have to monitor yearly. Because of my diagnosis, I became a child life specialist recreational therapist and started working with the pediatric hematology oncology population. I love working with pediatric cancer patients. I love giving them hope. I love giving them understanding of what their diagnosis is. But I remember my very first week at that hospital so saddened by the fact that treatment really hadn't changed in all of those years. Survival rates hadn't really gone up that much, and kids were still dying of cancer. To me, that was just unacceptable, being over 10 years later. There are still some childhood cancers out there that have little to no treatment. What that means is upon diagnosis, those kids are often considered terminal. Imagine being a parent and getting that news. Imagine being a child and getting that news, or a sibling, or somebody who loves that person dearly. From 2009 to 2019, 9 out of the 11 drugs used to treat acute lymphocytic leukemia, the most common type of childhood cancer, were in and out of shortage. How is that possible in this day and age? How do you expect kids to survive if they can't even get the chemo needed to help them? To me, that's just not acceptable. That's why I think it's really important to raise awareness, not just about what childhood cancer is, but what actually is happening. I've seen the looks on parents' faces when their child is diagnosed. I've seen the fear in kids' faces, not understanding why they're getting stuck by needles, losing their hair, having that fall out. I've taught kids what their diagnosis means. I've helped kids cope with their treatment, the tests that they're getting, and I've attended far too many funerals of many children. I am not rare. I'm asking you to make childhood cancer a priority this month. I'm asking you to go gold, the color of childhood cancer. Even though I survived, I'm still paying the price. But we can change that. for many kids in the future. We need to make it everybody aware that childhood cancer is a lifelong diagnosis. It's not just 2.5 years of chemo. It's a lifelong diagnosis of living with the aftermath of that chemo. Our kids are important. Don't they deserve better? I think so. So help me go gold. Share my Facebook posts with people. Put a gold ribbon on your Facebook profile. Share my blog on leukemiagirl.com with people. Share my book with people. Talk about childhood cancer and how it can affect others. We all know somebody who's had cancer. Cancer is a really common thing. But how many of you know childhood cancer survivors? How many of you knew what to do and how to help when you heard that a neighbor had cancer, or that one of your kids' classmates was just diagnosed with cancer? This month, we're going to talk about that a little bit. And I'm here to just raise awareness about what childhood cancer really is. Thank you.